Hello, welcome to Health Talk. I'm Dr. Manny. It's a new trend across the country. Women are getting vaginal rejuvenation to improve their sex life. Joining me now is Dr. Edward Jacobson from the Vaginal Rejuvenation Institute of Greenwich. Thank you for coming.
Good morning, man.
Vaginal rejuvenation. This is a new one. You know, in my old days, we used to have vaginal surgery for women that had, you know, problems with bladder problems or things of this sort. But now women are looking to rejuvenate their vaginas on the basis of improving their sex lives.
That is correct.
So what is the procedure?
This procedure is a modification of a very traditional surgery for correcting urinary stress incontinence. Women don't necessarily have to have stress incontinence.
Now, stress, let's explain what stress incontinence is.
That stress incontinence is when a woman coughs, laughs, giggles, and loses control of her water. Okay? And this is a modification of that surgery that allows women to enhance her sexual experience. During the process of childbirth, there's a lot of stretching of the vaginal tissues, there's loss of tone, there's loss of strength, and this surgery, as a modification, is designed to decrease the vaginal diameter, increase frictional forces so she can have the same sexual experience she had prior to having children.
Now, let's go over how this procedure is done. Is this done in the hospital?
This is done virtually all times as an outpatient surgical procedure at a licensed surgery center or at an outpatient facility in the hospital.
What is the typical duration of the operation and some of the complications that women can expect?
Okay. The operation is usually done under twilight anesthesia with
twilight meaning not so much general, but something like a sedation.
Exactly. A woman is breathing on her own. There are no tubes are placed into her. She wakes up 2 or 3 minutes after the procedure, and is done in conjunction with what's called the local or regional block anesthesia.
So then you apply local anesthesia to the vaginal area.
So she is comfortable for the next 6 to 12 hours after the surgery. The surgery itself takes about an hour and a half to 2 hours, depending upon the complexity of the surgery. The healing process takes a good 4 to 6 weeks. As far as complication rate, it's extremely low, probably 1% or less. The typical complications that can occur with any surgery: bleeding, infection, anesthetic risks. One is always concerned about possibly too much tightening of the vagina, but that comes with the expertise of the surgeon.
Right. What, is it very expensive?
The prices range. Usually the fees range anywhere from $6,800 to $10,000, which tends to be inclusive of the surgeon's fee, anesthesia, and the surgical facility.
Now, I find it you know, a little difficult sometimes, because one of the indications as I started the segment was that women are looking for these types of procedures to enhance their sexual life. But that's a very difficult object to sort of target, so far as, you know, how do you judge whether or not this operation did indeed improve their sex life?
Well, this all starts with a consultation.
Okay.
Because you have to make a determination: is a woman's objective to have sexual arousal, orgasm, or does she have sexual dysfunction? Because you don't want to subject these women to surgeries that are not going to be effective. Woman has to clearly state that she has no physical feelings, and that has to be consistent with her physical examination.
Are there any psychological components that you think would disqualify a woman from getting this operation?
Absolutely. One has to make an assessment, again, at that initial consultation, that the woman is pretty much together in her sexuality. I think an experienced physician would be able to sense that somebody is not appropriate for surgery. In fact, I decline numerous women each month from having the surgery.
Now, aside from the sexual enhancement that you get from the operation, there is also women that request this from a cosmetic point of view.
Okay. This portion of the rejuvenation is not so much cosmetic as it is functional. There is a resculpturing or cosmetic redevelopment of the outside of the vagina. The area in particular interest are the labia, the inner lips of the vagina, which oftentimes can extend out beyond the outer lips. There can be a cosmetic aspect to that. Most of the women that I see have functional issues. That is, they're spinning, they're running, they're horseback riding. They have a lot of discomfort. They can't fit into thongs. They can't fit into jeans, into bathing suits.
Right.
And this is a very serious issue for them. And it's not a matter of, in my opinion, of their sexual self-image. I do believe it is a true physical impediment to their lifestyle.
What's the range of age that you see in these requests coming to your office?
Okay. Well, for the labial rejuvenation, labial reduction, that is usually a younger group of women, anywhere from 16, 17 years of age up to about 45 to 50.
Wow.
For the vaginal rejuvenation, clearly it's in the childbearing age group, usually about 10 years later than that.
Now,
but we've had patients up to 70 years of age who are sexually active who would like to have an improvement.
Now, we were talking before we started the program a little bit about these women that get these types of vaginal procedures. If they want to have children, this is not a contraindication to having children.
Absolutely not. However, if there's been a major reconstruction in the vaginal tissues and a woman's contemplating delivery, I think she really should have some forethought as to the mode of delivery on a subsequent pregnancy. That is probably a cesarean section to protect her surgical outcome.
Insurances, are they paying for this? Because they won't pay for an ultrasound, never mind.
Well, for labial reduction, probably not. There's very few of that. As far as vaginal rejuvenation, vaginal tightening, if there is a component of urinary stress incontinence which is repaired at the same time or adjusted at the same time, the answer to that is yes.
All right, real quick and final question. Choosing a doctor for these types of procedures, what is the criteria? What is the criteria that should be taken?
Women should do their due diligence. They should research their doctors. They're seeking out doctors on a website. The doctor should have a resume or a CV out there, and know not only what the doctor's background is, his or her experience, his or her association with a medical institution, but what their surgical experience is. This is really paramount.
Very good. Thank you so much for coming.
You're very welcome, and thank you for having me.
So until next time, I'm Dr. Manny with Health Talk.